Hello, everyone. My name is Pam Guerrero, and I am Chief of the Laboratory of Allergic Diseases at the National Institutes of Health. Today, I'm going to be talking about allergic disease and its connection to Loeys-Dietz syndrome. And then I will hand things over to Tony Guerrero, who will discuss nutritional issues and LDS. We have no conflicts of interest to report, and we may be discussing some off-label use of medication. So first, what exactly is an allergy? Well, one of the primary jobs of the immune system is to protect us against infections. And to do this, the immune system has to be able to distinguish between substances in our environment that need to be attacked, such as bacteria and viruses that cause disease, from substances that are foreign to our body but aren't necessarily harmful, such as pollen and food proteins. An allergy results then when the immune system reacts or attacks one of these innocuous substances. Allergies are extremely common in the general population, but they are even more common in people with Loeys-Dietz syndrome. This seems to be the case for essentially all the different forms of allergic disease. The most common allergic disease to affect people with LDS, as well as the general population, is allergic rhinitis. This is not a life-threatening condition, but it can certainly have a tremendous negative impact on quality of life. People with allergic rhinitis typically experience runny nose and congestion, coughing and sneezing, and watery, itchy eyes. Allergic rhinitis can also make asthma more difficult to control in those who have both diseases, and can also impair sleep and one's ability to concentrate and function well at school or work. Some people only have these symptoms at certain times of the year, such as the spring or fall, but this really depends on what you're allergic to. Here on the East Coast, tree pollen tends to peak early in the spring, grasses in the summer, and weeds in the fall. However, people who are allergic to mold, pets, or dust mites may have symptoms all year round. In our research, we found that nearly half of people with Loeys-Dietz syndrome have been diagnosed with allergic rhinitis, which is significantly higher than what you see in the general population, where about 20% of people are affected. There are two main methods allergists use to determine what you are allergic to. Both these methods are looking for a substance called IgE, which is the allergic antibody that is specific for a given allergen. So with skin testing, we introduce a very tiny amount of the allergic substance under the skin. And if the person is allergic to that substance and has IgE to that allergen, the allergic cells in their skin will become activated. And this results in swelling and redness that looks a lot like a mosquito bite. In addition to skin testing, we can also measure the level of IgE that is specific for different allergens in the blood. So once a diagnosis of allergic rhinitis is made, allergen avoidance is really a key part of the treatment plan. This can be difficult, as you might expect, for patients with pollen allergy. For these people, it can be helpful to try and limit time outdoors on days when pollen counts are high and using air conditioning and keeping the windows closed. Even something as simple as changing clothes or showering after spending time outdoors can help reduce pollen exposure. If you're allergic to cats or dogs, a HEPA filter on your vacuum cleaner or a HEPA air purifier can sometimes be helpful. Dust mites tend to thrive in moist environments, so we recommend that people who have significant dust mite allergy try and keep the relative humidity in their home under 50%. If it's a child who's allergic to dust mites, then limiting the number of stuffed animals they sleep with, as well as removing carpeting in the home, if that's an option, can also help. We also recommend that patients cover their pillows and mattresses with dust mite covers, as well as wash their bedding in hot water at least weekly. So if allergen avoidance is not sufficient to control symptoms, the next step is usually to use medications such as antihistamines for symptom relief. If this is not adequate, then an intranasal corticosteroid spray can be tried. Many studies now have found that steroid nasal sprays are really among the most effective treatments we have for allergic rhinitis, but it's really important that people use these on a daily basis in order for them to be effective. And then finally, allergy shots, which are also called allergen immunotherapy, are sometimes recommended when the response to medications for allergic rhinitis are not adequate. Although the exact mechanisms by which allergy shots work are not entirely understood, 70 to 80% of people who undergo allergy shots do actually show improvement in their symptoms. This is a very time-intensive process. Most people require weekly shots for a period of months, which are then spaced to every 2 weeks for 3 to 5 years. However, because we are injecting the exact substances that people are allergic to, it's not uncommon for patients to experience allergic reactions during the course of treatment. And in some cases, these reactions are severe and need to be treated with epinephrine. Now, epinephrine is extremely effective at treating severe allergic reactions, but it does so by increasing blood pressure and your heart rate, which are not desirable effects in someone with Loeys-Dietz syndrome. So for that reason, we generally recommend that people with LDS avoid receiving allergy shots, particularly since we can usually maintain adequate control of symptoms with medications. So allergen is another common allergic condition, both in the general population and among people with LDS. Asthma is a condition where the airways, the tubes that bring air to and from the lungs, tighten up and become very narrow because of swelling and the accumulation of mucus and inflammation. There are many different triggers for asthma attacks, including exposure to allergens, cigarette smoke, cold air, and pollutants, as well as exercise and viral infections. One of the primary symptoms we see in patients with asthma is cough, especially at night, and in the early morning, wheezing, shortness of breath, and chest tightness. The main medications that we use to treat asthma work by either relaxing the muscles surrounding the airways so they open up or that target the underlying inflammation. So while asthma affects just under 10% of the general population, 45% of people with LDS in our study have been diagnosed with asthma at some point in their lifetime by their doctor, and almost 40% require daily medication to control their asthma. In our experience, we have found that chronic sinus infections can also sometimes be a trigger for asthma in some people with LDS. This increase in sinus infections does not seem to be the result of a problem with the immune system or reduced ability to fight infections, but it's more likely related to the structure of the bones of the skull and how the sinuses are able to drain. Aggressive treatment of sinus infections, sometimes with several weeks of antibiotics, is sometimes necessary and seems to dramatically improve asthma in some people with Loeys-Dietz syndrome. So eczema, which is also known as atopic dermatitis, is diagnosed clinically and is characterized by an extremely itchy, dry skin rash, as you can see in the picture here. Eczema is treated with emollients and moisturizers to try and improve skin hydration, and topical steroids and other medications that treat the underlying inflammation. Eczema is also more common in people with LDS, affecting up to 40% of people with LDS, compared to only 10 to 20% of the general population. So food allergy is also quite prevalent in people with LDS, although it can be challenging to distinguish food intolerances from true food allergy. So food allergy is an immune reaction to the protein content of food, whereas most intolerances are related to the carbohydrates in food. A good example is lactose intolerance, where patients are missing the enzyme that breaks down the sugar in food. With food allergy, even tiny amounts of the food can cause an allergic reaction, and in some cases, these reactions can be severe and not life-threatening. So using a very strict definition of food allergy, where people had to have a convincing history of an allergic reaction to the food, along with positive IG testing to that food, we found that over 30% of people with LDS have food allergy, compared to only 3 to 6% of children in the general population. So many LDS patients are allergic to multiple foods, but some are allergic to only one or two in foods. It's important to recognize that our current tests for diagnosing food allergy are far from perfect, and some people will have a positive test to a food, but not actually be allergic to that food. The best test for a food allergy is whether you can eat the food without having symptoms. And as I mentioned earlier, there is no question that epinephrine can be life-saving if a patient is having a life-threatening reaction to a food. And we do recommend that anyone with LDS who has a food allergy always have an EpiPen available with them. However, as I mentioned earlier, because of the effects of epinephrine on the cardiovascular system, we are more cautious about using it in people with LDS, and we would recommend that mild local reactions only be treated with antihistamine and epinephrine be reserved for those reactions that affect multiple body systems and are potentially life-threatening. This is something that can be very important to discuss with your child's school and daycare. I'm aware of some schools, for example, that have a policy where they administer epinephrine even if there's only a suspicion that the child ate a food they were allergic to, even if they weren't showing any symptoms. So the most common food allergies in people with LDS tend to mimic those that we see in the general population, with milk, egg, peanut, soy, wheat, and tree nuts being most common in children, and then nuts, fish, and shellfish in teenagers and adults. The type of symptoms that might indicate the presence of a food allergy can range from chronic low-grade symptoms that might just affect the GI tract to more acute reactions that occur within minutes to hours after eating the food. Some symptoms that would suggest the presence of food allergy, including hives or swelling, trouble breathing or cough, or a drop in blood pressure in patients who have very severe reactions and anaphylaxis. So right now, the only treatment we have for food allergy is strict avoidance of the food and ready access to self-injectable epinephrine in the event of an accidental exposure. However, this changed in January of 2020 when the FDA approved the first oral immunotherapy or OIT product for peanut allergy. With OIT, patients allergic to peanut actually ingest peanut powder, starting in very tiny doses and then increasing over the course of weeks or months until they reach a maintenance dose, which they then take daily. This peanut OIT product has only been approved for use in children, and patients must still strictly avoid peanut while they were on the treatment. The goal here is to protect against allergic reactions that might result from an accidental exposure to peanut, rather than to allow patients to fully eat peanut in their diet. In the studies that have been done, almost 60 to 70% of children were able to tolerate a single peanut kernel after treatment. Well, that amount of peanut was enough to cause an allergic reaction before they started treatment. However, OIT has an extremely high rate of side effects, causing many children, up to 20%, to stop treatment. And many children will need to use epinephrine to treat allergic reactions that, perhaps not surprisingly, occur during the course of treatment. It is because of this high rate of reactions and the need for epinephrine that we would not recommend people with LDS who have peanut allergy to undertake this treatment at this time. So thank you so much for listening. I am very happy to take any questions you have, but I'm going to first turn things over to Tony Guerrero, who will be discussing GI and nutritional issues in LDS.
Hi, I'm going to tell you about another type of food allergy, and you can think of this food allergy more as a slow motion food allergy. It's very different from anaphylactic food allergies that Pam was telling you about. And what you get is an infiltrate of eosinophils in the lining of the intestines as a reaction mostly to food proteins. And since the part of your intestines that has the high exposure to food proteins is the esophagus, the most common place to see this type of slow motion allergy is in the esophagus, and it's called eosinophilic esophagitis, or EOE. Now, this type of slow motion allergy doesn't turn into the anaphylactic food allergies that Pam was talking about it, but the testing that she discussed, so the skin testing and the blood testing, is not useful in terms of finding the food that's actually causing the allergy. The only way that this can be diagnosed is with an endoscopy with biopsy. And when you do this, you'll see a dense accumulation of eosinophils in the esophagus. And this is coupled with upper tract symptoms such as trouble swallowing, food getting stuck, or reflux. We find that in people with Loeys-Dietz syndrome, they're much more likely to have eosinophilic esophagitis, about 10% of people with Loeys-Dietz syndrome compared to about 0.05% in the general population. Symptoms of eosinophilic esophagitis can be many different things. In young children, it can be feeding refusal, reflux, vomiting, or poor growth. In older children, typically what we see is trouble swallowing, food getting stuck, or chest pain. And at any age, you can see, interestingly, diarrhea and trouble gaining weight or actually losing weight. There are 3 treatments that we use in EOE, and those treatments are to reduce the inflammation, reduce the number of eosinophils in the lining of the intestines, and to prevent strictures or scarring that can lead to food getting stuck. The 3 treatments are high-dose proton pump inhibitors, which are also used for acid reflux, dietary modifications, or swallowed topical steroids. There are some investigational biologic therapies, but there's nothing that's been approved at this point for eosinophilic esophagitis. When you start discussing what treatments are most appropriate for you, there's lots of things that need to be considered in that conversation with your doctor. So one thing we find, all of these things play into the nutrition and growth of people with Loeys-Dietz syndrome. So when you have allergic disease, it takes energy to keep that allergic inflammation going. But also people with Loeys-Dietz syndrome may have unrecognized food allergy or intestinal inflammation. And as you can see, when we look at people with Loeys-Dietz syndrome with a food allergy, their body mass index or their weight for how tall they are is lower than those without food allergy. Other things that lead to lower weight in people with Loeys-Dietz syndrome can be repeated surgical interventions and hospitalizations. And very frequently, we see some weakness in the jaw muscles that just makes it hard for people to chew up significant amounts of food. And they just tire out after eating for a while. Inflammation can affect growth. So as I said, it takes energy to keep that inflammation going. And if you have inflammation in your GI tract, that can prevent the absorption of nutrients. Also, even if it's not preventing absorption of nutrients, when there's an inflammation, what the white blood cells think they're doing is fighting an infection. So that, as Pam said, they're reacting inappropriately to a food protein and treating it like it's an invader. And if the white blood cells are fighting an invader appropriately, they're going to send signals to your body that say, don't grow, don't gain weight. We need all the energy to fight off this infection. And so if this inflammation is ongoing and never resolves because that food is still in your diet, or the eczema is not under control, you're going to have trouble gaining weight and you're going to have trouble growing. So what is the right weight? How do we know if your weight is appropriate? So one of the things that needs to happen is at every visit, you need to have your doctor graph out your body mass index if you're older than 2 years old, and that's your weight divided by your height squared. Or we look at just the weight for height if you're less than 2 years old. And these are what those graphs look like, and your weight and your height should be graphed out, or your body mass index should be graphed out on these at every visit to keep track of, are you gaining weight and are you growing appropriately? So people with Loeys-Dietz are at a higher risk for developing almost all forms of allergic disease. However, the diagnosis and treatment for these conditions is similar to the general population. However, we do caution against using certain medications that affect the heart and vascular system, such as epinephrine. If there is uncontrolled inflammation, this can affect your growth and your body mass index, or if you're less than 2, your weight for length should be plotted at every visit. We'd like to thank the people that we are collaborating with, both at the NIH and at Johns Hopkins. And with that, we'll take questions from everyone.